Dawson, I'm Jalyn. I'm a nurse on the floor. Just coming in to check in on you. What brings you in today?
Hi, Jalyn. It's nice to meet you. I've been having some issues with my legs and my feet. I feel like my feet are always cold all the time, and I feel like, I don't know, I just feel like I'm not moving like I used to be able to.
Okay, so have you been having any pain in your legs and your feet?
I've been having a lot of leg and feet pain. Yeah.
Okay, is it worse whenever you dangle or when they're elevated?
Well, I can't use my recliner anymore because when I put my legs up, it's just like terrible.
Okay, and have you noticed any wounds or anything on your feet?
I haven't really looked.
Okay, well, I can have you take a seat, and we're going to go ahead and do a little bit of assessment piece here. Okay, so I'm going to check out your foot here.
My foot?
Okay, so first of all, just looking, and I see that, while it's dangled down, it's reversed, so you've got some red feet here. You said it doesn't hurt while it's dangling?
No, not when it's dangling.
Okay. And this temperature is cool. You said your feet were freezing?
Yeah, it takes like 5 blankets.
Okay. All right, then we're going to check some cap refill.
Is that good or bad?
Well, normal cap refill is less than 2 seconds, and yours is taking about 4 or 5 to refill. So having a little bit of problems with our circulation, but we're going to get that checked out and see what we can do about it. Okay.
Is that blackness on my toe bed?
I see, yes, you've got some
I never noticed that before.
on your toe here.
It kind of smells, doesn't it?
Just a little bit. Some black on the toes here. So that just shows it. So I think that since we've got the even borders, black tissue, there's not any edema on your foot or anything, no drainage that we can rule out. Venous insufficiency, I'm thinking we're probably looking at more of an arterial issue. Do you have any history of like high blood pressure or heart
runs in like the
problems?
140s, 150s half the time.
Okay. And what about smoking? Do you have any?
Like 10 packs a day, man.
Okay, all right. Have you ever tried to stop smoking or?
Nah, who has time for that?
Okay, so that can be something that we look into. I tell him all the time to stop smoking, but he doesn't listen to me. I worry about it all the time, but.
Hey, I enjoyed it since my childhood. When I was 14, I started with like a pack a day, and it's just gone up since then.
Let me just listen to your heart and lung sound really quick.
Okay.
Listen to heart sounds first. Sorry, we're a regular rate and rhythm. Go ahead and get in contact with our provider and see what steps we need to take next to see kind of what our lab findings are. And hey, Mr. Mullis. So
Hey.
I checked with the provider and we've got ordered. We're going to draw some blood to just look at some of your different levels, specifically cholesterol and your triglycerides and things, and your platelet count, just to kind of see a little more about what your circulatory status is looking like. And then we're also going to use a Doppler to check out the pulses on your feet, because I wasn't able to palpate any earlier in my assessment.
You're not gonna hurt me with that, are you?
Oh no, this is going to do is just going to go put some little cool jelly on your foot, and then we'll it'll just tell us kind of like an ultrasound if your wife has ever had one of those. Okay, all right, so you can have a seat. We're going to draw blood first. Okay. All right, great. No pressure. Oh, that's good. We'll send this off to the lab. Okay, now I've got my Doppler.
Oh, my foot doesn't smell too bad.
Okay, so we're getting a lot of very diminished pulses. It's very dirty there. Okay. Okay, so it seems like we're not getting a whole lot of blood flow down to our toes, which is also why, again, we've got the black on the bottom of the toes here. They're going to be coming up and to get you in just a little bit to do an exercise test, and I'll come back and give you your test results from our blood test and more from the doctor about the circulation.
God, it sounds.
All right, Dawson, how was that exercise test for you?
Man, I'm not gonna lie, it was pretty rough. My legs are hurting like the dickens.
Cramps a lot whenever you're using your legs?
Yeah, I haven't exercised in a while.
Okay, I gotcha. That could be something that we can look into as far as treatment planning also. But I've also got some lab findings for you. So with your blood test that came back, we've got some, there's a little bit of high levels for your cholesterol, specifically LDL. That just kind of more of a clogging of your arteries. And you also had some high triglyceride levels and lipid levels, and your platelet count was a little high. So we're going to consult the vascular physician and see if he can get an order in for some medications to see what we can do to get your circulation a little bit smoother and clear out some of that cholesterol and fat in your arteries. And then I just want to ask you a few more questions about your diet. What are some things that you typically eat for like lunch and dinner and things like that?
Well, if I can add something here, I would just like to say, I noticed that he loves Chick-fil-A. He's always eating Chick-fil-A, like all of the chicken nuggets and sandwiches and everything, and he never really works out to like try to get at least a little bit healthier.
God
And
will
so
provide.
God, he is our provider.
Amen.
Jireh, come on. Okay. All right, so these are some foods that are higher in some fats, and it's gonna, and you know, that kind of adds to your higher triglyceride levels and cholesterol levels.
But I thought chicken was good for you.
Grilled chicken and baked chicken. There are definitely some ways that we can implement some
That's the
healthier
grossest thing on the
versions of
menu.
All right, well, I'm gonna get in contact with the vascular physician, and I will be back as far as what some treatment plans are and what our goals are. Okay.
Got it, Nurse Jalyn.
Attention. I was just going to call and see what your recommendations were as far as treatment plans for there. Okay, so I should be looking on the order for some aspirin and atorvastatin.
Contact with our vascular physician, Dr. Smith.
Dr. Smith.
And yes, so he went ahead and ordered some aspirin and atorvastatin. We noticed on your chart no history of liver failure or anything, correct?
No.
Okay, so basically some important things to know. If you notice any types of bleeding problems, or you know, definitely call about that. As far as the atorvastatin, do not eat any grapefruit or drink any grapefruit juice. That can have some interactions and stuff. But yes, if you have any allergic reactions that you know of or any odd symptoms, just go ahead and give us a call and we can get you checked out on that. So I'll go ahead and give you those.
Wow, these look like some big pills.
Yes. And then ultimately, our treatment goals are going to be to improve circulation, kind of keep your cholesterol under control, which is going to, again, the atorvastatin is going to help with that. To help thin the blood a little bit, your aspirin is going to help with that. And then we do want to kind of control some of the diet and smoking problems. We have other options for smoking if you wanted to try a nicotine patch. We provide you with some information about that as well before you leave. Different diet options, diets that have a lot of fish in it, that's higher in the HDL cholesterol, that'll help lower your cholesterol as well. Maybe cut back a little bit on the Chick-fil-A. And then exercise, as far as that goes, just some moderate walking, even if it's just a walk around your neighborhood, 30 minutes a day, that would be great. And then
I do have a question.
Yeah, of
if
course.
I may add. I noticed that his stress levels are always like super high, and like every little thing he gets stressed out about, and I don't know if that could possibly affect it, or like ways that like we could bring down the stress if it does affect it.
I mean, that's what I use smoking for. My wife is just too much sometimes. Sorry, I don't mean to talk bad about your mother.
Well, stress definitely can affect that. It increases your blood pressure. It can just cause a lot of different problems. So definitely some relaxation tips that you can use. Just breathing exercises, journaling. If you have some type of community that you're involved in, whether it's watching sports with friends or attending church or different aspects like that. And then if you have further complications where you feel like just different coping mechanisms aren't helping, we can get in contact with your primary care provider and maybe look at some antidepressants. And that can also control some of the anxiety levels or stress levels, sorry. And then we are going to want to minimize the compression on your legs, so just some looser pants, not socks that are too tight. Yes. If we compress, it can kind of cut off some more in the circulation.
Oh, I thought compressing was good.
See, if there are multiple different types of perfusion complications, with your situation, we're having trouble getting the blood down to your lower extremities. So if we compress, we're really just cutting off more circulation. Okay, so yeah, we're going to improve circulation, control cholesterol, thin blood, Do some moderate exercise. You want to drink lots of water. And then try and incorporate some less fat in the diet and more like HDL type foods like fish. And yes, if you also sleep with your head elevated, that helps kind of get blood. Gravity does its work, gets the blood down to your extremities. And yeah, so let me go ahead and get you that pamphlet for your smoking cessation. You've got your prescription there. If you have any questions, you can give us a call. And I'll see you back in about a month for a follow-up.
Sounds good.
Hey, Mr. Moles, it's good to see you back.
Howdy, howdy.
How you been holding up?
I've been doing so much better. My feet feel so much better. I cannot tell you how better they are.
That's great. What have you noticed?
Yeah, I've noticed some crazy changes as well. I noticed that his stress level has gone down a lot. He's been using those relaxation techniques you've been talking about, and he's been using he's been slowing down smoking a lot. He's been using the nicotine patches, and so that's helped a lot. And
You'll have to stress me out. I just slap one on.
All right.
tell Mom said that.
And then how have the medications been working out for you?
I feel like it's been going good. I had to tell my wife it's a statin. She thought I was seeing Stacy, so
Oh no.
we fixed it. I showed her the bottle, and she got better.
Okay, that's great. And no any signs of allergic reactions or anything?
I don't think so.
No?
I wasn't a fan of grapefruit in the beginning, so.
Okay, fantastic. And let's see, your foot looks a lot better. Got a little bit warmer here. You haven't been using any compression stockings or anything,
No,
so
ma'am.
we're doing great. And then how's the exercise
and
been
Crocs.
going? Socks and Crocs, that's
It's
great.
been pretty good. I don't cramp as much.
Okay,
Keep up with the same regimen, and then we will follow up with you in 6 months.
Sounds good to me.
All right.